Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Foot anatomy and causes of pain. The foot is a complex structure made up of 28 bones, 33 joints, 19 muscles, over 100 tendons and ligaments, and more than 200,000 different nerve endings. These work together to allow you to walk, run, maintain balance, absorb impact, and bear upper body weight. /r/n/r/n The foot is also vulnerable to injury, including traumatic and repetitive use injuries, as well as diseases and disorders like arthritis, infections, bunions, and plantar fasciitis. These conditions can not only lead to pain but also to significant loss of mobility and quality of life. /r/n/r/n Problems with your feet may require diagnosis and treatment by different specialists, most commonly a foot specialist, podiatrist, or a bone and joint specialist, orthopedist. Other specialists may be involved depending on the underlying cause. /r/n/r/n The foot has three parts: theforefoot, midfoot, and hindfoot. There are 28 bones in each foot, categorized according to their location. /r/n/r/n The forefoot is comprised of 21 bones. /r/n/r/n The midfoot is made up of 5 of 7 tarsal bones that help form the arch of the foot. These 5 bones are collectively called distal tarsal bones, distal meaning further away from the center of the body. /r/n/r/n The bones of the midfoot conform to the variable surfaces as you move, absorbing shock as you land from a jump and lift a heavy object. /r/n/r/n The midfoot bones are comprised of /r/n/r/n There are only 2 bones of the hindfoot, known collectively as the proximal tarsal bones, proximal meaning nearer to the center of the body. These are responsible for transmitting the entire weight of the entire body to the foot. /r/n/r/n The proximal tarsal bones are comprised of /r/n/r/n Joints are the part of the foot where 2 bones come together. Joints are covered with cartilage and contain lubricating fluids which help the bones glide smoothly during movement. In all, there are 33 joints in each foot. /r/n/r/n Your big toe has 2 joints. /r/n/r/n The other 4 toes have 1 additional joint. /r/n/r/n The midfoot has 2 major joints and many minor ones. These are collectively known as /r/n/r/n The hindfoot contains 2 major joints. /r/n/r/n The 19 muscles that control the movements of the foot start in the lower leg and are attached to the bones in the foot with tendons. /r/n/r/n These are the main muscles that facilitate movement in the foot. /r/n/r/n Tendons are connective tissues that attach muscles to bones. 3 major tendons help with plantar flexion and dorsiflexion. /r/n/r/n Ligaments are connective tissues that connect bone to bone. There are over 30 in each foot, some of the most important of which include /r/n/r/n The foot has over 200,000 nerves that send and receive signals from the brain to enable motor function, movement, and sensations, such as temperature, pressure, and pain. /r/n/r/n Major nerves of the foot include /r/n/r/n Each of these nerves, in turn, has numerous branches with different names that service different parts of the foot. /r/n/r/n The average person has walked about 75,000 miles by the time they are 50 years old. Given how many moving parts the foot has, it makes sense that it's vulnerable to injury or overuse. /r/n/r/n At the same time, there are diseases and disorders that can affect the bones, joints, connective tissues, and nerves of the foot, causing pain and a loss of mobility. /r/n/r/n Alexandra Gordonrnrn Achilles Tendonitis is an inflammatory injury of the Achilles tendon. It most commonly affects runners and people who play sports like tennis that require lots of starts, stops, and turns. /r/n/r/n Untreated tendonitis can lead to the chronic breakdown of the tendon, called Achilles tendinosis. This can weaken it to an extent where the tendon can partially or completely tear, known as an Achilles rupture. /r/n/r/n Athlete's foot is a common fungal infection that is highly contagious. It is easily spread, mainly from moist surfaces like locker room floors and showers. If the fungal gets in and under the toenail, it can cause toenail fungus, also known as onychomycosis. /r/n/r/n Osteoarthritis OA, sometimes referred to as wear and tear arthritis, is the aging-related degeneration of joint cartilage that leads to joint pain, stiffness, joint deformity, and the progressive loss of mobility. /r/n/r/n In the foot, the small joints of the toes and ankles are most likely to be affected. Obesity can increase a person's risk of foot OA. /r/n/r/n A bone fracture of the foot, also called a fractured foot, is a common injury often resulting from a sports injury, a car crash, a heavy object dropped on the foot, a misstep, or a fall from a great height. Fractures can range from tiny cracks to a break that penetrates the skin. Around 1 of every 10 bone fractures occur in the foot. /r/n/r/n A bunion is a bony protrusion on either the inside edge of the foot or the pinky toe side. Bunions form gradually when the bones in the foot get misaligned, often from wearing shoes that don't fit or that squeeze the toes together tightly. /r/n/r/n The big toe can bend so far inward that it crosses under or over the adjacent toe, causing a secondary misalignment called a hammer toe. Usually, a painful callus will form on top of the second toe. /r/n/r/n A claw toe is a deformity of the foot where the toe bends downward from the middle joints. Sometimes, it will even curl under the foot entirely. Calluses or corns will commonly form on top of the claw toe. If our corn puts pressure on nerves in the foot, it can also cause pain. /r/n/r/n Pes planus flat feet, is when the arc of the foot straightens out. It may spread so completely that the entire sole touches the floor. Flat feet can cause pain in the midfoot area as well as swelling of the ankle and arch. The imbalance can also lead to hip, knee, or lower back pain. /r/n/r/n Pes planus can be something you're born with, congenital, but it's often related to age or an injury. Between 20% and 30% of people have some degree of flat-footedness. /r/n/r/n Gout, also known as gouty arthritis, is an inflammatory form of arthritis caused by the accumulation of uric acid crystals in a joint. Gout symptoms occur in episodes, causing extreme pain, swelling, and redness in usually one joint only. The big toes are most commonly affected. /r/n/r/n Gout can flare up when you eat foods rich in an organic compound called purine, which the body converts into uric acid. Symptoms may persist for a week or more. Recurrence is common. /r/n/r/n The calcaneus, heel, is vulnerable to injury as it is tasked with bearing most of the weight of this body. This, along with an imbalanced gait and faulty foot mechanics, can lead to bony overgrowths called heel spurs. /r/n/r/n Heel spurs, also known as calcaneal spurs, can cause severe pain when standing or walking. They are most common in people with plantar fasciitis, flat feet, or high arches. /r/n/r/n If you have a mallet toe, the joint in the middle of the toe becomes permanently bent and points downward. Mallet toes develop when there is an imbalance in the muscles, tendons, or ligaments that hold the bones straight. /r/n/r/n Like with bunions and hammer toes, a mallet toe often happens if you're wearing ill-fitting shoes. However, it can also be caused by trauma or some diseases. /r/n/r/n Metatarsalogia is pain under the ball of the foot. It's often caused by pressure from high-heeled shoes or from conditions like arthritis, nerve compression, fractures, or tears in ligaments that support the ball of the foot. /r/n/r/n Peripheral neuropathy is nerve pain caused by damage to the outer coating of nerve cells, called myelin. The damage can cause tingling, prickly, burning, or pins and needles sensations ranging from mild to severe. The feet are most commonly affected. Walking or standing can make symptoms worse. /r/n/r/n Peripheral neuropathy can be caused by any number of things that directly or indirectly damage myelin, including diabetes, HIV, alcoholism, autoimmune disease, back injury, heavy metal poisoning, and certain drugs. /r/n/r/n Morton's neuroma is a common foot problem where compression on a nerve in the ball of the foot causes burning, tingling, and pain near the third and fourth toes. It can make you feel like you have a pebble in your shoe or on a fold in your sock. Wearing high heels is a common cause of Morton's neuroma. /r/n/r/n Plantar fasciitis is caused by micro tears in the thick fibrous tissue on the underside of the foot. It's usually related to overstretching. Symptoms of plantar fasciitis include pain in the heel and arch that is often worse in the mornings. Plantar fasciitis is common in distance walkers or runners. /r/n/r/n A sprain is a partial tear of a ligament, while a strain is a partial tear of a tendon or muscle. The ankle is a common site of a sprain, typically caused when you twist your ankle during sports or a fall. Foot strains, by contrast, are due to overuse, most often in people with Achilles tendonitis and other types of foot tendonitis. /r/n/r/n To diagnose problems with the parts of the foot, a healthcare provider or a foot specialist will look at your feet for signs of swelling, deformity, skin growth, or misalignment. /r/n/r/n The provider may feel your foot to check for lumps and bumps, and move it around to see if it causes you discomfort. They will want to watch you walk around to see if there are any issues with the way you move. Gait analysis. /r/n/r/n Imaging studies commonly used to look for structural problems or injuries include /r/n/r/n The treatment for a foot problem will depend on the underlying cause. /r/n/r/n Pain may be treated with over-the-counter painkillers such as Tylenol, acetaminophen, or Advil, ibuprofen. Severe or chronic conditions like arthritis may require steroid injections or prescription pain relievers like Celebrex, celecoxib. Nerve pain may benefit from drugs like gabapentin. /r/n/r/n For foot problems caused by anatomical deformities, special inserts may be worn inside your shoes, called orthotics, to compensate for the problems and reduce pain. Physical therapy can help improve the strength and flexibility of the feet and ankles. /r/n/r/n Conditions like fractures, bunions, or hematoma may sometimes require surgery. /r/n/r/n The foot is a complex part of the body that is made up of many bones, joints, muscles, ligaments, and tendons. It can easily be injured, develop diseases, or get infections. Bunions, claw toes, flat feet, hammer toes, heel spurs, mallet toes, metatarsalgia, Morton's neuroma, and plantar fasciitis are a few examples of foot problems that commonly cause pain. /r/n/r/n A structural foot problem can be diagnosed with a physical exam, a review of your symptoms and medical history, a gait analysis, and an imaging test such as an X-ray, CT scan, or MRI scan. The treatment for foot pain is based on the condition but can involve OTC or prescription painkillers, orthotics, custom-fitted shoes, physical therapy, or surgery. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.